Hi, everybody. Welcome back to the Fired Up with CJ show. We've been talking to Tari Prinster. We're now in the second part of our two-part series, Yoga for Cancer, and how she's written a book, which is a guide for managing side effects, boosting immunity, and improving recovery for cancer survivors. And we were talking in the previous segment about how when you have cancer, it really reduces or sometimes just destroys your immune system, and how some of the side effects that come as a result of that is what some of the areas that you address in your book. All right, so I want to talk to you a little bit about what's happening to patients now with who are homebound, can't go to the doctors, have cancer, and how your program is helping them.
Well, yes, major portion of Yoga for Cancer is that it was an in-person experience where they were with a yoga teacher and in a room with other cancer patients and survivors. And now all those places where they did that, including clinics and hospitals and yoga studios, have been closed. So, or rather, they have are not allowing in-person experiences. But the marvelous thing of technology is, within a very short period of time, when we were all put into quarantine, um, we all went online and started doing the exact same thing, but doing it in a virtual setting. Even hospitals, I have many teachers who've gone through my training program who are teaching in very large hospitals, and their patients, and some of them who are already also in clinical trials and they are doing research. So what they have done is they teach online, which means that someone is in their home. And that's actually, in some ways, a more comfortable place to be. I've taken all of my classes online, and it's actually unfolded where I would be having maybe 30, 40 people in a class. I'm now having 80 to 150 people. So what I'm what I'm saying is that there has been a plethora of help and services that we are providing now than even before. And so we're keeping this community together, and we're actually growing the community.
Yeah.
Uh, for those who are in treatment, um, as which is different than those who are out of treatment, but those that I do know who are in treatment have been able to manage getting their treatment. There are very special entrances to the clinics where they would be going for an
Mm.
infusion. There are uh, the hospital and the clinics are taking great care, because it is really important to someone who is on a protocol of receiving so many treatments in such a period of time, that they stay on that in order for the treatment to be effective. So they are well aware of that, and the medical community has been wonderful in doing that. Of course, there are situations where some kinds of surgeries may be being delayed, but it is never in a situation that I have heard of which would endanger a patient's life.
Right.
Uh, and so I'm quite confident that the medical world has taken this into consideration. Um, and in my program, what we have taken into consideration is the fact that cancer patients, particularly, but even survivors after finishing treatment, are uh, are with compromised immune systems, which means that they are at risk, higher risk. And if they're elderly, we know that the elderly are at risk. If they have other comorbidity diseases, such as heart disease and cancer, then this puts them in a very, very elevated position of being vulnerable to COVID. And so what we're trying to do is build awareness of
Mm.
what to do to stay home and the whole point of yoga for cancer is boosting that immune system. Everybody needs to boost their immune system, whether they have cancer or not. We all in this environment, we all under this circumstance need to keep our immune system strong. Immunity is how we are going to fight lots of viruses, lots of diseases, but also cancer. Um,
Okay, and I just want to ask, so for people, and you had said earlier, I mean, I'm starting yoga for the first time, I'm, 85, I haven't been moving around very much. I can do a yoga class all of a sudden. I mean, is this something that people are jumping into without a lot of training, and is that advisable?
Well, what I take great care to do, and I have on my website, is if you've never done yoga before, here's what you need to know.
Okay.
And the book also talks about it in that way. The book also has sections on, what you need to know to get started.
Okay.
Um, and the way the methodology is constructed too is sort of that you go at your own pace.
Mm,
The mini classes that I have written addressing side effects are also what I would call leveled. So there is a Nuda yoga level. There's a in recovery level, and then there is getting strong and getting stronger level. So that everyone kind of has to go at their own pace, their own speed, and their own um, um, and I guess the really important thing too here is that the whole idea of yoga for cancer is that you become your own agency. That's what we, as yoga for cancer teachers, try to do, to help people understand how to read what's going on in their body.
mm,
As a cancer patient and survivor, you learn that really quickly
mm,
to know, okay, I'm having a pain in my left big toe,
mm.
but that doesn't mean I have left big toe cancer.
Right.
So learn how to monitor our bodies in a way that is more um, mindful,
Hmm.
for a useful word in that regard, to listen to the body, because our mind is constantly being a distraction to what is really going on.
Mm.
It wants to tell us what the body is doing and feeling, and it knows less about what's going on than our body does. So it's learning how to listen to the language, the
Right.
conversation with the body.
Right, getting more body awareness is what I'm hearing. And then how do you when I start, I understand that you have these levels and you mentioned before that one of the symptoms is that you feel very fatigued. And so how many minutes does it take? How often how often you're asking do you recommend to get some of the benefits that people do some of these mini programs?
Well, surprisingly, it's only been in, remember my 20-year thing when I started, but in the last 5 years, the American Cancer Society has come out with a measure and a recommendation of what a cancer, what to do to avoid cancer and what a
Right.
cancer patient should do.
Hmm.
And they recommend two things: exercise and diet.
Hmm.
And they have very specific parameters around exercise.
Hmm.
The amount of exercise a patient or long-term survivor should get is 150 minutes a week of moderate exercise. And they include yoga as they include the active yoga that yoga for cancer is, as a moderate exercise. So that's what the American Cancer Society says. Um, what I say and what I did while I was in treatment and what I do for myself now as a survivor is I do some yoga every day.
Hmm.
And when was a patient, that might have varied from one day it felt like 10 minutes, and another day it might have felt like um, 90 minutes. It really
Oh,
depended.
wow. Wow.
And I would do that as and I do that now myself. You know, probably more on the average of 75 minutes a day.
Yeah.
But that's way more than 150 minutes a
Right.
week.
Right. Yeah. Okay. And then if people want to sign up for your classes, it sounds like you're doing online classes. And if I'm at home suffering, I can sign up for your classes and take them. How do I sign up? I know you have your website, y4c.com. Is that where I go to sign up for the
Yeah,
classes?
it's
Okay.
very easy. There is um, immediately what comes up, find a class for survivors,
Okay.
and also find a teacher, because I've trained over 3,000 teachers from around the world,
Wow.
just in the US. And a map comes up with, you put in your zip code, and your zip code is Japan, Tokyo, Japan, and there will be a whole bunch of little green dots, which indicates that there are yoga for cancer teachers there in Tokyo,
Wow.
Japan. Um,
Wow, how fabulous. So at any point during a day, I can probably, so if I'm like, I'm not feeling it now, I'd like to do it an hour from now. And usually, if I'm in the West Coast, there's specific time slots that are
right.
typical. I can go to your website and find something wherever I
The,
want at the time. That's
right.
amazing.
Well, I mean, the online classes that I do and that are already recorded, and they're not live. We have many classes online, that a 50-minute class, a 30-minute class, that are permanently there. They're not live.
Okay, so I actually watch it on a video and I may put that on my TV or put it on my phone or my iPad and go through the class together so I can pause, do whatever I need. It's not a
Exactly.
live class because I know here in Seattle we do live yoga where the
Well,
teacher is doing.
there are live classes too,
Okay, so
and
they're both.
that's back where you are. You don't have to be in Seattle. I mean, you could be in Tokyo
Yeah,
and
yeah.
I mean, in fact, I do have teachers in Tokyo who are giving live classes in Tokyo,
I
and
love that.
I can jump on in the middle of the night and take a live class in Tokyo. But
I love it. And are they going to be in the language of that country? So is it someone speaking Japanese who's going to be?
the the classes in Japan are in Japanese. We have teachers in all over Europe,
Wow.
even in Turkey, and mine, of course, are always in English.
Yeah.
But and that's another thing too that I want to mention about my book, which it is translated. There's a Spanish version, a Japanese version, an English version, obviously, and soon to be a French version.
Yay, great.
Yeah.
Wow, what a wonderful service. That's really fantastic. Thank you so much for being on the show. Can
Yeah,
you hold up your beautiful book again?
absolutely.
Thank you so much.